I'm pleased to introduce to you Emily Ishado. She is a geriatric clinical social worker with over 20 years experience working with older adults in a variety of healthcare settings, including outpatient mental health clinics, skilled nursing facilities, home health, and primary care. She's currently the program manager for the UW School of Nursing Dementia Palliative Education Network, which aims to provide health care for people living with dementia and to improve that health care and their care partners through education, training, and research. Recent and current projects include implementation of an immersive and experiential long-term care course for undergraduate nursing students, dissemination of a comprehensive dementia care curriculum, and development of a self-care intervention for dementia care partners. And she has tremendous expertise to share with us today, focused on enhancing wellness through mindfulness principles. Welcome, Emily Ishado.
Yes. Well, thank you so much, Barb, and thank you to Northwest GWEC for inviting me here today. I'm really honored to be able to talk with you a little bit more about enhancing wellness through mindfulness principles, and really appreciate all of you attending. I know everyone has very busy schedules, so I appreciate folks participating here today. And just a quick note, I did take a mindfulness-based stress reduction course several years ago. And so I'm really excited to talk more about this topic, how I learned about it and use it, and then also how we could apply it with the older adults that we work with. And so for today, or for the purposes of today, I'm going to be talking about enhancing wellness, more so in the context of addressing and managing stress, anxiety, and depression. So I'm going to talk first about, these three topics briefly, and then we'll be spending the majority of the time talking about mindfulness principles. So first, to start talking about stress, I was curious if anyone has ever felt or wished that they wouldn't get stressed anymore, or just wish that they would stop feeling stressed. If this applies to you, I can say you're not alone. So in the outpatient behavioral health and mental health therapy that I've done, this is something that's not uncommon, where folks feel like, gosh, I just wish I would never get stressed anymore. And one of the ways that I start talking to them about it is by really discussing, what is the purpose of stress, and kind of normalizing these needed emotions and responses. Because ultimately it is helping us to take action and make decisions. And so how can we think about stress differently sometimes, as opposed to kind of like the enemy and the thing that we want to avoid? Because stress is our brain and body's natural way of just responding to pressure, demands, or threats. So it is something that is needed. And so when we look at stress and just like the general cycle around, what happens with our body and what the purpose is, we start at the top, you see there, in a neutral state. So perhaps, hopefully, we're in a neutral state right now. And then an acute event then happens. And so as an example, let's say right now, I heard someone scream really loudly. Well, what would happen at that point is the stress hormone would be released, so cortisol. And the purpose is it's trying to help redistribute the energy, trying to increase like sugar. And so just to kind of get me activated and boost my immune response, because ultimately stress is trying to get me to act on something, do something. So maybe the resulting action is I check, I see, oh, perhaps somebody fell outside. So I go to them, sort of maybe do some simple first aid and call 911 as needed. And then hopefully perhaps the medics come and they, take that person away and care for them. And at that point, we get to the resolution, or we've resolved the issue, and then we come back to our neutral state. So this is kind of, the purpose of stress and just the cycle and how it's meant to really be something that helps us. However, certainly chronic stress has its risks and challenges. And so if we're chronically, in this acute state where we're feeling stress, or that cortisol is being released, and we're constantly going into this stress response, it is going to result in various, risks for physical, medical, and emotional behavioral health issues. And so these can be things like having headaches or forgetfulness, experiencing more increased risk for depression and anxiety, additionally more susceptible to colds, flus, muscle pain, heart issues, diabetes, weight changes, sexual problems, GI issues, fatigue, and then potentially skin issues as well. So it is certainly something, that we do want to manage and pay attention to. And then when we look at stress generally across the lifespan and sort of what happens as we're aging, as we get older, we do have an increased difficulty manage that physiological arousal that comes with, our body is activated and we need to take action. Additionally, multimorbidity or having, multiple chronic conditions could also increase that vulnerability to the stress. So that's why these are things we do want to, pay attention to. However, there is good news for us as we age. And that's one is that research has shown like there tends to be a decrease in some of the daily stressors that we experience throughout adulthood as we go into older adulthood. We start to learn how to have a gentler appraisal of the stressors. So perhaps things that seemed very stressful previously, we don't see it as significantly stressful anymore. We're better able to differentiate what's an actual problem and what's like a stressor and just something that I need to deal with. We know better situations that we want to avoid. So if there's certain, events and we don't like crowds, we just know better I'm not going to go to this type of event or situation. And then we're also better able to cope by shifting our attitudes towards more of the positive aspects. So we can kind of positively redirect and reframe things as well. And so as I was thinking about, stress and in the context of the 4Ms, it seems to really speak to that sense of what matters. As we are feeling stressed, as we age, it looks like we do have that capacity to better look at what our values and priorities are, and then better able to manage that stress. All right. So next we have anxiety. And so, thinking about anxiety, I'm also curious if anyone has ever wished, I just wouldn't get anxious anymore. I wish this anxiety would go away. And again, this is something that, isn't uncommon when I've done behavioral health therapy sessions and the clients that I've worked with. And so it can be helpful to, again, sort of look at really what is the purpose and what is the function of anxiety, so we can kind of better respond to it and understand maybe what it's trying to tell us. And so anxiety, generally it's just this emotion, apprehension, somatic symptoms of tension, and we're just anticipating maybe some sort of danger or catastrophe or misfortune. And it looks like, we're feeling worried and nervous, and we might have that physiological response of the faster heartbeat or sweating or muscle tightness. And it's meant to act as this like internal warning system where ultimately it's trying to help us with decision making and increasing our sense of safety. If we never felt anxious or, and never felt worried about our surroundings or what's going on, we could, walk into some dangerous situations or things that, might impact us or harm us. And so really it's trying to help us plan, problem solve, take preventive measures and keep us safe. And that's something we kind of want to listen to and, and kind of understand and interact with. However, similar to stress, if it does become problematic and becomes a disorder, this is something that we really want to try to mitigate and address. And so this is when, it's this excessive and persistent fear that is impacting our daily functioning. Some of the symptoms can be the frequent or persistent worries, feeling tense, restless, fearful, increased irritability, a panic or sense of doom. And it comes with some physiological symptoms as well, like so that increased heart rate, rapid breathing, trouble sleeping, nausea, upset stomach, sweating, and or shaking. And the physical health risks are, similar to that of the stress. kind of like possible heart issues or digestive issues, weakening our immune system. And then in looking at anxiety symptoms in older adults, the prevalence is about 11 to 14% of older adults experiencing these symptoms, which is still lower than adults overall. So, and then looking at anxiety and, the aging process and what might be some risk factors for older adults. So one is having chronic medical conditions, things like COPD, cardiovascular disease, and diabetes, pain, limited physical mobility, isolation, stressful life events, and life changes. And, as I'm looking at these first three bullet points, I think they really speak to that sense of loss that starts to occur or can occur in as we age and in older adult life. As we're like losing some functioning around, our general health or, pain and not able to access the community as much, or if we're isolated and we, don't have the same support system, or just other life changes that happen, that really impacts us with this sense of loss, that can really be associated with anxiety. And I think that's because there's a sense of loss of control over your circumstances. And that's certainly anxiety inducing, because if I don't know what's going to happen next and something can just happen at any time, what am I going to do about it? And so I think, that's really important to kind of think about these factors in working with older adults and how that might be impacting them. Additionally, other risk factors are sleep disturbance and substance misuse or abuse. However, again, good news though, throughout the aging process, that the likelihood of anxiety does decrease as one ages. So they kind of see anxiety as sort of having this U-shaped trajectory, in which the prevalence is higher in younger adulthood, and then it dips in middle adulthood, but it does start to increase again in older adulthood, though not as maybe prevalent as young adulthood. But what they do find is that those that are kind of in the older adulthood ages, such as 80 or 90 years old, are less likely to have anxiety. And they kind of attribute this to, just like that increased ability to cope, more resilient, and really able to make meaning out of situations, which can help you acknowledge and accept, what's going on and seeing like a greater purpose and value around it. And so this was, again, really making me think about how what matters can really help older adults, manage the anxiety and things where they can, really turn their attention to what's the value, what does it mean? And then really looking at on the left-hand side, the mobility, how much mobility can really increase that risk of anxiety. So if mobility is impacted, that can really increase that anxiety and worries and, again, lack of sort of control or trust around your surroundings and things. So next, we'll talk about depression. And so similarly, kind of was curious, if anyone has ever felt like, oh, I wish I wasn't sad, but really ultimately, what if we were never sad? What would we be missing out on? What's the purpose of feeling sad, which isn't a comfortable feeling for sure. And so, as I've been talking with, the clients, we talk about these types of concepts, what is the purpose? What is the meaning? What is the value of sadness? And some of the things that we've come up with are, can you really understand happiness if you're never sad? Conversely, do you understand peace or do you understand, peace? Yeah, if you're never anxious, or do you understand calm if you're never stressed, or contentment if you're never angry? And so it's really like, how do these sort of kind of polar opposites really help us to experience the full breadth of life? Additionally, with being sad, I think that's really our opportunity to connect with other people, to self-soothe, to be more compassionate and kind to ourselves and turn towards what is it that this sad feeling is wanting or needing from me right now. Sadness is just part of being human. And ultimately, I think, and the clients I speak to, kind of we come to this sense of like, yeah, it would be very boring if I were never sad. I would be giving up all these like, variety around all the different feelings that I can experience. And I don't know if anyone watches Apple TV, but there's this show called Pluribus. And it's basically about there's some kind of, I don't know if it's a mutation or a virus that infects everyone except for 13 people. But the virus causes you to be very calm, content, happy. Everyone gets along. Everyone's helpful. They all cooperate. They do what they need to do. They, just all sleep in one big room or, don't, just like no need for these like possessions or other types of things. And, on the sense of where, oh gosh, if we all just got along and we're happy, it sounds like it would be great. But, what this person is like really realizing and struggling with is like, I think there is that lack of connection and lack of reality and lack of what's real and what's honest and really that vulnerability, to be able to, connect with someone on those levels. So sadness is, a needed emotion. But of course, if it becomes problematic and turns into like a depressive disorder, that's something that we do want to try to mitigate. And, depression is this negative affective state of unhappiness and discontent and pessimism and something that's interfering with our daily life and functioning and lasting 2 or more weeks. Some additional symptoms to look at with older adults is hopelessness, guilt, worthlessness, decreased energy, loss of interest, difficulty with memory or concentration or decision-making, changes in the sleep and appetite, increased substance use, physical symptoms, which it might be expressed more like as having pain or digestive issues or cramps, and then suicidal ideation. And so in looking at the prevalence among older adults, about 8.7% in the US, and also it kind of follows similarly to anxiety, that U-shaped trajectory where it's higher in the younger adulthood, dips in middle adulthood, and then increases again, starts to increase again in older adulthood. And then so looking at depression and some risk factors in older adults. So again, having medical conditions, multimorbidity, and really the sense of how is this decreasing their physical health and or cognitive functioning. If they've had personal, history, that does increase the risk that it happens again, or family history of depression, a loss of partner and social support, loss of life purpose, financial stressors, and substance use. And so again, kind of in looking at that list, it kind of speaks to that sense of that aging process and the changes and losses that can sometimes occur. And how much that would affect, maybe our concept of ourselves, how we feel about ourselves, how we think about ourselves and our identity. And, what an impact if we lose that sense of life purpose, or we lose those people that are important to us, and then we start feeling more isolated, or we lose who we think we are. Like, I'm very active and now I can't walk as far, And so these are all risk factors that we certainly want to pay attention to. And then, yes, and looking at, the 4 M's again, if we're losing that sense of what matters to us, that can really increase our risk. With mentation, depression, managing depression is part of that, that area of mentation. And then again, how mobility changes and especially loss of mobility or decreased in functioning can really increase that risk. However, good news again, their intervention options do exist. So there are things that we can do about it when it comes to kind of managing or mitigating depression. And that's what brings me to now mindfulness. So first, in talking about mindfulness and really what is it, I admit for myself too, it's this very enigmatic kind of concept. And it's something that honestly always doesn't always make sense to me either. But one thing I find is like the more I try to understand it or deconstruct it, the less I know. But the more I practice the principles of mindfulness and just being in the moment, the more it makes sense to me. So, hopefully as we talk through this, if you're not familiar with mindfulness, hopefully it can help understand a few of the concepts around it. However, when thinking about mindfulness, ultimately, what's the definition or what is it? And certainly there can be several various definitions of, what is mindfulness. But what I have here to start is a publication that was looking at what do just people who practice mindfulness, so not necessarily, scholars, researchers, or anything like that, but just people who practice mindfulness, how are they defining mindfulness? What does mindfulness mean to them? And some of the themes that came out of these interviews was that they defined mindfulness as attention and awareness to the present moment, a non-evaluative attitude, a strategy to regulate emotions and attention, a state of well-being or a psychological or spiritual state. They saw it as personal development. So things that they do within their lifestyle or self-knowledge or just connection to self and or environment. So there's many different ways that, we can look at mindfulness. And then for today, I did specifically want to call out the definition from John Kabat-Zinn. And so he's the developer of the mindfulness-based stress reduction course that I think started in the late 70s. And we have a course here at UW, and that was the course that I took several years ago. But his definition is to pay attention in a particular way, on purpose, in the present moment, and non-judgmentally. So we'll be going through these 7 principles or attitudes of mindfulness. And so that's going to be non-judging, patience, beginner's mind, trust, non-striving, acceptance, and letting go. And as we go through each of these concepts, you might start to see I use the same words to define each concept. And that's because all of these are so interconnected, with each of the other principles. And it's really hard to kind of explain all of these in this like standalone manner. So there is, quite a bit of overlap, within all of these concepts. They all lead into each other. And then as we go through some of these principles, I thought we could kind of think about it in the context of like just a sample, case study of a person. Let's say this is, if you're a healthcare provider, this is your patient, a 79-year-old who had a recent stroke. They currently live at home with their spouse. They use a wheelchair. And previously, they were able to walk and engage in community activities and manage household tasks. So their prior baseline was, they were quite functional. And so they've really gone through a significant loss. All right, so for the first principle, we have non-judging. So I'm curious here if anyone's ever felt like they are their own worst critic. Because non-judging kind of speaks to that sense of, we can sometimes, and myself included, just be our own worst critic. And on the left-hand side, sorry, in the red box, these are the things that we're wanting to try to avoid if we're going to practice non-judging, okay? So on the red box on the left, we have where we're judging ourselves, we're seeing things as good versus bad. And the thing is, the more that we're like really criticizing ourselves or, maybe situations and looking at it in this like real black-white sort of way, it's going to then really impact our reactions. If I start thinking, oh, I can't do this well, or that's not right, or this isn't how it was supposed to be, well, then I'm going to start getting frustrated, upset, stressed, anxious. And then that impacts how I'm going to respond from there. Maybe I'll retreat or I'll do it really forcefully and very slothily or something. And so instead, on the right-hand side, we have the green box. And this is where, with non-judging, we're trying to approach situations with just more awareness, observation, and kind of just witnessing it. for as it is, not this was good or I did this good or this is good and bad, but how can we just look at things as just being aware and seeing what is going on. And so if we look at our 79-year-old woman, perhaps, she's judging herself like, oh, I'm bad. I'm worthless. I can't even walk. I can't do anything. I'm just terrible, and is really judging herself and being very self-critical. And so what might happen from there? Perhaps she's going to just give up and feel really sad, or maybe she'll get more angry and irritable. Maybe she's going to not do PT or any of the other, treatments and things that she's going to do, because she's going to say, well, I'm just bad. I'm worthless. I'm no good. So what's the point? And so instead, how can we help her maybe through some validation, and also, demonstrating it and using it ourselves, validate her feelings, but kind of show her this sense of just being aware, validate the situation of this is really tough, and just acknowledging and seeing, oh yeah, your legs seem to move a little, they're moving differently than they did before. And that is more of an observation and awareness instead of this like real specific good versus bad. So next principle we have is patience. So on the left, we have this sense of impatience and rushing towards the outcome. Well, the thing is that when we're impatient, it can take us out of the present moment and less, aware and connected to our surroundings. When we think about, and it can lead to more frustration and stress and things. And so if you think about, being in traffic, and, Seattle traffic is up and back, and with I-5, for anyone that are in this area, it's getting really tough now. And so when we're in traffic, maybe we're running late for something and we have to get there, and we're going lane to lane to lane to lane and trying to get a little bit ahead. And, in that moment, and they show that, when we try so much to, lane cut back and forth, it saves like maybe a minute, couple minutes, maybe a little bit more. It really doesn't like help that situation. And it only causes us more stress, anxiety, frustration, instead of just trust and allow for what is. So on the green box, and just accept the moment of just being in traffic or just being there. And it is what it is, and having patience with that process and allowing for that process. And, when we do that too, sometimes it can really open us up to see other things in our surroundings, or refocus our mind onto other things as well. Like maybe we're able to appreciate, now that I'm sitting in traffic and it is what it is, maybe I can appreciate, the sunset, or, other things in our surroundings. So we can maybe see things that we weren't necessarily paying attention to. And so again, in thinking about our 79-year-old patient here, maybe she's really rushing and she's very impatient about, I got to get better. I have to, get to all these events and do all of these different things, and the more she's like rushing and like, I got to get to the end, the more she starts feeling stressed and frustrated and anxious, and maybe not taking all the right steps or the things that are really going to help her, because she's so focused in on, I just got to get better. And so instead, how could we use more, trust, allowing, and acceptance of the moment to help her increase her sense of patience, and, just allowing, and again, with that validation and acknowledgement of, the challenging situation that she is going through, and maybe demonstrating this sense of, for us to have patience in that situation too, and so maybe that can help model things for her as well. So that would be patience. So next we have beginner's mind. So on the left, in the red box, you'll see it's holding on to beliefs or having expectations. And, sometimes when, we have expectations around what is going to happen, that can then start to impact, our behaviors and our focus and all kinds of things. And so, for example, if we think about we need to address an issue either with our family or our coworker or friends or something, and it's something kind of like, we have to address something that we're a little bit upset about. And so we're already playing it in our head, and we have this belief of, oh, they never take it well, and they're just going to get mad and blame me instead, or they're just going to act like it didn't happen. And so as we do that and we have these expectations, we're already starting to build ourselves up around, okay, I'm going to be defensive and I'm going to have all my arguments ready and set, you know. And so then, and that then will impact the interaction from there. And will get us kind of flustered ahead of time, instead of how could we have more of a beginner's mind, receptive to new possibilities, sort of seeing a uniqueness around the moment. And the picture in the green box, you see it's like a child with a helicopter toy. And they talk about beginner's mind in the context of kind of this childlike wonder, childlike curiosity. And how can we just, an example of if we were going to talk to somebody about an issue, be curious around, just open to maybe they'll take it differently and just be present in the moment so that there's a way in which you could really take in what's going on and understanding the context a little bit better. I also think about sometimes with parents and children, and they're, frustrated around a child's behavior. And they're having these belief and expectation, oh, they always like defy me and they always do this and that type of thing. And yet, when they are more receptive to new possibilities and have a beginner's mind, sometimes they can start to identify the little changes, the little bits of improvement that they otherwise wouldn't have seen because they're already like, oh, they're never going to listen to me. Oh, they're never going to do this. And so, beginner's mind is meant to help us open up to those sorts of possibilities. Additionally, when we have expectations of it's supposed to go this way and it's going to happen like this, that's also, can be challenging because if it doesn't go according to our expectations, that's disappointing and maybe more frustrating. And so how can we, again, have that receptiveness to the new possibilities and the uniqueness of the moment? And so in thinking about our 79-year-old person here, maybe she has this belief and this expectation exactly how she's going to get better, what it's going to look like, how long it's going to take. And then it doesn't happen in the way that she's thinking about it. And so she's more frustrated and, upset and angry and maybe starts giving up again because she's like, it's no use. Instead, how can we help them to have openness to new possibilities, sort of like this curiosity, again, with the observation around just what is happening in this moment? And maybe that she would be able to start to see, actually, I can move my leg a little more than I did last week. Or actually, I feel differently a little bit than I did last week. And being able to be receptive to those types of things. Okay, next we have trust. And so on the left-hand side, it says, external guidance and uncertainty. And, by external guidance, I don't mean by any means that you should never get advice. Certainly, getting guidance and support and, consultation is good. But this is talking more in that sense of where we're always sort of questioning ourselves instead of really trusting like our gut, listening to ourselves, and honoring our feelings. So sometimes we might be in a situation where we're like, oh, am I supposed to feel this way? Am I supposed to be doing it like this? Or, and we're so uncertain that we get more, anxious or worried or frustrated or distressed. Instead of sort of, again, trusting and allowing for this experience, validating and listening to ourselves, honoring our feelings, and sort of allowing that sense of just that, unknown be there and trust what we feel we know inside. And so that's a little harder one to explain, sorry. But in thinking again about our 79-year-old, so perhaps this, patient is, thinking, gosh, why am I so mad or sad about this situation? Am I supposed to be feeling this way? I should be more grateful. I have my family around me. They're helping me. My spouse is doing all of this work. I don't know, am I supposed to be doing this? Is that right? Again, instead of how can we help her, to try to honor some of those feelings and that experience, and just listening to her gut around, yeah, this is part of just what's going on, and being able to allow for that. Maybe even also show herself some compassion too. So this one is non-striving. So on the left-hand side, it says, finish line, checklist, goal orientation. So again, not to say we shouldn't have checklists or we shouldn't set any goals. I have checklists. That's the only way I remember what I'm supposed to do. And, of course, I set goals. Goals are really important to help us, structure and focus what it is that we're working towards and help us to get things done. However, when we set a goal or we have this sense of where we're just striving towards the end, that also takes us out of the present moment of what's going on around us, as well as causing more of that stress, perhaps, or frustration or anxiety or sadness or depression. We're so focused on getting there, doing that thing, that we miss out on everything that's just happening throughout the process. And we're not being observant or connected to our surroundings or perhaps each other or other people. And additionally, sometimes there's this sense of the more we chase something, the more it escapes us, instead of just kind of allowing this process to be. And like on the green box on the right, being just in the present moment, paying attention to what's happening and what's our surroundings, instead of always trying to change and get to the end. And, additionally, when we look at goal orientation, while again, they are really good, how can we combine it with more value-based living? When we are very focused on the goal, goals have endpoints. So if I were to say, oh, I want to, run a marathon by the end of this year, and then I run the marathon at the end of this year, well, then what? I'm finished. How could I make a value-based sort of orientation where it's like, I want to have good cardiovascular health. I want to be active. I want to, maintain my weight or, whatever it is, so that it's more of a value-based living. So in looking again at our 79-year-old, perhaps, she really wants to walk and she has to get back to her activities, and gardening season is coming up and she has to be ready by that point. And so she's really focused in on all of that, right? But how can we help her acknowledge the present moment? That's great. Yes, let's get back to gardening. That's a wonderful thing to aim for. But what do you have right now and what's going on right now? How can we be in this present moment? That could then open up other possibilities, such as how could you do some gardening related stuff now? Maybe there's prep work that you can do that, or maybe there's adaptations that we could make. What was it that you enjoyed about gardening? And so there's different ways that she could look around at that situation and perhaps be more connected. Okay, so this is my favorite one. This one I have a very true to life story to share. And so this one is acceptance. And as you can see on the left-hand side, the red box is denial or resistance, and on the right is just acceptance. And so, as I was taking that mindfulness course several years ago, for one of the classes, they talked about pain is inevitable and suffering is avoidable. And so when they said that, I was, very confused, pretty frustrated, and unclear of what are you talking about? How is suffering avoidable? And so they talked about, well, if you practice acceptance, then you can avoid that sense of suffering, but the pain will still be there. And I'm just like, oh my goodness, that does not make sense. There is no way that is true. And so, a few days later, I'm in Seattle and I work on campus at UW, and I park a mile and a half away from work at that point because I don't want to pay for parking. And so it's the middle of winter. And so if you know this area, the middle of winter, sun goes down at 4:15 p.m. It can be very rainy and cold. And so on one of these days, it was, cold and the rain is coming down, and I'm walking back to my car. And as I walk, there's puddles everywhere, and I'm doing my best to avoid the puddles, But, eventually I just can't avoid the puddles and my feet get soaked and my pants are, soaked up to my knees. And one more thing is that my biggest pet peeve is being cold and wet. So I was in pain, I was miserable, I was angry, I was frustrated, and I was in a lot of denial and resistance because I just kept thinking about how much I hate the rain, how horrible it is. I'm moving away from Seattle. I am never coming back. This is the worst city that has ever existed. And I was just fuming in my head and I was frustrated and continually getting more, distressed. And then I remembered this concept of supposedly I'm supposed to accept this and my suffering will go away. And so I decided to spite my teacher. I am going to do it just to prove her wrong. So I said to myself, okay, it's raining. I'm miserable. I'm cold. I hate it. And it is what it is. And the amazing thing is from that point, I actually suddenly was no longer suffering. I was no longer in this state of distress of, I hate Seattle. I hate this. Why does it have to rain? My mind went to just the usual things that I think about after work, like maybe work, maybe what I'm going to do on the weekend, my family, my friends. And I still had another mile to walk to my car, but I made it back to my car, got home, wrung out my socks, of course, took a shower and changed my clothes and went on with my day. And so that's when I really started to understand the power of acceptance and what it meant. Because acceptance isn't, I agree with it or I like it. Or that's okay. It's not like, oh, I like the rain. Oh, yeah, it's okay that it's raining. It's no problem to me. No, I hate the rain and it is a problem for me. But it's more just this acknowledgement of what is happening and this willingness to just see things as it is. And so, when we come to our 79-year-old, patient here, how, maybe she's feeling all that denial and resistance. Shouldn't have happened to me. Why did it happen? Why is I in this situation? This is terrible and all of that kind of stuff. And, I think that validation and acknowledgement is, very important here too. Like, yeah, you've gone through a lot. That's really tough. And this is what's happening now, and just like kind of acceptance is a kind of a process. So it might not be something you just talk about once, but just really acknowledging that and the loss that it is and, kind of building that sense of awareness and maybe acceptance towards what happened to her. And then our last principle is letting go. So kind of similar, it's holding on, kind of similar to like denial or resistance. And, the more that we hold on, instead of letting go, it doesn't allow us to, again, be in the present moment or see things as they are and maybe appreciate more things that we hadn't really been paying attention to. And so, how can we, letting go is just this acceptance of things as they are and just allowing it to be what it is. When you practice mindfulness, for anyone that hasn't perhaps, if you did a guided mindfulness, a good way of practicing this concept of letting go is this visual of leaves on a stream. So, when practicing mindfulness, ideally you don't have these ambient thoughts coming in and out of your head, but it's very hard. I mean, I have thoughts that still come in my head. But, let's say you're practicing mindfulness and then a thought of, oh my gosh, I need to remember to get this thing done by Friday. That thought pops into your head. All it is you acknowledge it and you visualize a leaf flowing down the stream and you just put that thought on that leaf and let it go and let it flow down the stream. And so that's one way of starting to practice this acceptance of, or this practice of letting go is, leaf on a stream, visualize letting it go and just allowing it to be as it is and returning back to, the practice of mindfulness. And, as you do that, of course, you want to try to not judge and be like, I can't believe I'm, not able to, focus on my breathing for 5 seconds. Just acknowledge it, put it on that leaf and let it flow down the stream. So similarly, to our 79-year-old, the more that she's holding on to this expectation or what it should be, or just whatever it is that she's holding on to, the more distress it causes. And how could she let go and accept as is? How could we continue to validate and acknowledge all of that is happening and the situation as it is for now with our own sense of acceptance. So maybe through modeling again some of that behavior that can help her sort of let go and come back into the present moment of what's going on right now. Where are things at right now for today? So next, looking at some benefits of mindfulness, it has, it generally can decrease your stress. And then specifically when they've looked at older adults, there is a significant decrease in anxiety and depression. Mindfulness is, changing how we focus our attention and respond. So it's really helping us, kind of reframe things or just change, what we're thinking about or how we're paying attention to things. It increases our capacity to cope with challenging situations. With older adults, it's been shown to increase their working memory. And then it can also help with mental clarity and focus. It can improve sleep, quality of life, and personal productivity. And it actually also can help with some of that pain management or maybe reduce the experience of pain or the suffering, I should say, actually. And, this is something that I also have done with some of the older adults that I've worked with, in that, the mindfulness meditation that you can guide them through is sort of this sense of where they're changing focus between areas of pain and areas that don't have pain. So when I've gone to someone, maybe they're experiencing a lot of pain and they're like, oh, I'm not feeling well. I'm in so much pain. I try to, acknowledge the pain that they're feeling. And then I ask them, is there anywhere in your body that you're not feeling any pain? And sometimes they're like, no, I have pain all over. I'm just in pain. And then I really try to help them, zero in on any of the smallest areas. It could be their earlobe, maybe the tip of their finger, or the tip of their nose, or their eyebrow or something, and really help them zero in on any place that they aren't maybe feeling pain. And then the mindfulness meditation just walks them through, okay, focus, allow that pain, explore it, using all the principles of mindfulness, observe, don't judge, just allow and have curiosity. And then, experience whatever it is, your sensation you feel in the tip of your finger, if that's the area where they don't feel pain. And so as they kind of switch focus on these two different areas of their body, afterwards, they have told me, oh, I feel a little bit better. And I think one thing that might be going on is that, no longer are they, I am in pain, where that encompasses like their whole being. They're able to acknowledge this part of me feels pain. And so it doesn't feel like this overwhelming, overarching, I'm just in pain. So that can be how it helps with pain management. And then, in looking at the 4 M's, certainly mindfulness, really can help them with what matters and paying attention to, kind of what is their surroundings, what's important to them, maybe connect and engage, with their environment or other people. With regards to medications, of course, this isn't a medication, but maybe it's a, non-pharmacological medication. In looking at older adults and, really wanting to be careful about the medications and especially, psychotropic medications, which older adults, there's various risks and not all of them are responding to like antidepressants and things, and they have various side effects. So how could mindfulness be sort of like a non-pharmacological medication or treatment that they could use? Of course, mentation, it helps you with focus and everything and can help them address the depression that comes in the medication category. And then also mobility. I think it's good to think about mobility because with mindfulness, there are actual mobile walking types of mindful meditations or exercises. And, with mindfulness, it's not about how fast you walk, how far you walk, how long you walk, or anything like that. It's really about, again, just kind of the sensation of maybe as your foot hits the ground, what do you notice? What are you sensing? What is that experience like? And a way of helping bring them, some attention to their body and how it's functioning. And it's not a requirement of, doing it really well, and something you could do even sitting. Okay. So, I wanted to end with, actually, for anyone that would like to participate, no pressure to participate if you don't want to, but a very brief mindfulness practice. And I'll say, this is something that I also use in session, or when I'm, meeting with clients and things. And especially when, if someone presents to a session, or I see them and I'm working with them and they're very activated or very stressed or very anxious, I kind of acknowledge that and say, wow, it looks like, you're feeling really anxious, or you're feeling pretty stressed. Can we take a moment to just do some breathing and grounding exercises? Would that be okay? And, in just a really brief period of time, the clients then are able to ground themselves, and then they're better able to just engage into, the interaction or the visit, and they're better able to process information, take information in, and then we can really work together. When they're in a very activated state, it's really can be challenging. So I think it can be helpful to use in these brief moments if, patients are, very anxious or stressed. Additionally, some simple things that you could also try to use as well, that I've used is kind of like simple biofeedback sort of measures. When I did home health, I would take oximeters with me. And it was really more so that I could just measure their heart rate. And so if they were kind of feeling distressed or something and they had an elevated heart rate, I would have them wear the oximeter, and we would check their heart rate, and then do a little bit of mindfulness, and then check again. And, if it lowered just a few beats per minute, I think that was really reassuring to the clients to see, like, oh, I have some control over this. I can calm myself. I can, manage my physiological responses. So this can be a good thing that you could try to use. And so as we go through this, couple things. One, I'm going to time it just so that I can let you know afterwards how long it actually took. And two, for those of you that want to participate, I certainly do encourage you to try to utilize the 7 principles, or, through this practice. And again, that is the non-judging, the patience, beginner's mind or childlike wonder, trust, non-striving, acceptance, and letting go. All right. Okay. So for any of you who would like to participate, that's great. And if you just want to take a break for now, it's really brief, that is fine too. But I'm going to get my timer started. So let's just start by adjusting or situating yourself in your chair or otherwise. And just get comfortable in whatever position best suits you. And when you're ready, you can close your eyes if you'd prefer. And just start by taking in a few deep breaths in through your nose and out through your mouth. And as you exhale, allow yourself to relax further into your position and release any tension you might have. And now, as you continue to breathe in and out, maybe you can start visualizing breathing in peaceful or calm air. And as you exhale, breathe out anything that you'd like to let go of, whether that's anger, frustration, stress, anxiety, or something else. And maybe now just take in one more deep breath. And as you exhale, start to bring yourself back to the present moment of being in your room. You can wiggle your toes or move your fingers. And when you're ready, you can open your eyes. All right. So I'll just end here. I have a few resources that you can look at. It'll be on the handout and things. But yes, I'm, kind of ready to take any questions. I would love to hear any feedback of what that experience was like. If it was great, then good. If it wasn't good, that's okay. And so the real main thing is that just by practicing it, that's a good first step. And it's just meant to allow you to have that first try at it. And for anyone that did do it or curious, that was 1 minute and 38 seconds. So not too long, and maybe something that maybe if you need it yourself, or maybe if there's time in a session, you could do that with patients too. So thank you. Oh, sorry, Barb. Oh.
Great. Thank you so much. I'm just wondering, I have a question of curiosity for you. If you have a sense of, I know that, yoga involves a lot more muscular, larger, limb kind of thing, but there's also there seems to be some mindfulness meditation kinds of thinking. I was just reflecting as I was doing the exercise here that when I used to take yoga, I would often get so relaxed I'd fall asleep.
Yes.
And I'm wondering if you have a sense of the overlap and the distinctions between those aspects of yoga and mindfulness.
Yeah. Yeah, no, absolutely. Those are very much well connected, and that's all part of that movement and that sense of just experiencing that feeling and allowing. And funnily enough, because I kind of judge myself when I do yoga, it's like I need to practice those principles, because like if I can't get the exact right pose and I'm frustrated, and then it's like no, just allowing it. It's more about the whatever it is that you can do, and and that's as much as you can do, or that's where you're going to be at, and that's okay. But like yes, they're definitely connected, but I don't have like enough of a sense of like how to describe or maybe perhaps distinguish, but I yeah, sorry.
No, that's great. Well, as people are thinking about their questions, and I'm hoping you're thinking about this in terms of your encounters with older adults. So I have a question. I'm going to throw it into the chat, but I'll read it also. In your encounters with older adults, how do you evaluate and identify wellness considerations? For some of you that you're in multiple different settings, when do these kinds of wellness considerations come up, and how do you sort of evaluate and identify those in a very busy interaction with an older person, a patient, a client? And if you have additional thoughts, you've already gone over a bit of this, Emily, but if you have additional thoughts, feel free, because you actually, I know, have experience considering these issues from a social work perspective, but also you've engaged a lot with nurses and other healthcare professionals along these lines.
Yeah. No, I think it's like, kind of, I like that question. It's kind of that sense of looking at potential risk factors and then identifying and just screening and checking for those types of things. So like thinking about, I mean, when we do appointments, if it's a annual wellness, that's great. Screening is great. But when it's an appointment, sometimes, an issue's actually happening and they're being treated for a problem sometimes. And so I think it's like having that consideration of how is it, impacting them? How are they feeling about it? And kind of, I guess from that social work perspective, how is it impacting their behavioral health and things? So, yeah.
That's great. And then Aaron brought up the possibility of just entering into the discussion by saying, is there something you enjoy doing? Which I think gets at that first M about what matters too.
Is that specifically for me?
No, I think it's a suggestion.
Sorry. Yes.
Yeah.
Yes.
Okay. About how to kind of engage in these kinds of encounters with older individuals.
I like that.
Yeah.
Yeah, that's a good idea.
Because to be honest, if you get a question like that and the response is, full of anxiety and stress, that gives you some cues too that
Yeah.
they're having a hard time right at this moment coming up with what they enjoy doing.
Yeah. I am curious if I could pose a question too.
Sure.
How folks envision or think that they might use these principles in their practice with older adults, and what they think would be kind of a barrier or a facilitator that helps with that process?
And maybe I'll step in while people are thinking, because Emily knows when I was talking with her the other day that, a barrier for me is I'm a very sort of pedantic, linear thinker, analytic. And so mindfulness is not something I need some encouragement, I guess.
Yeah. Yeah, encouragement is really helpful in those moments of it's the opposite of what we sort of understand and know. We think about it and then we understand it. And this comes from a different direction of you're just feeling it and allowing it to be. And so I think that's, yeah, it's difficult.
So Rabelais is asking, what's the best mindfulness you would advise to do when you're having a hard time?
Oh, interesting. You know, I think it's really good to just take those breaks and identify that you're having a hard time and looking at one thing that I like to do is sometimes it's just, well, body scan is something that I really enjoy. Because you're just being present with different areas of your body. And so really kind of what we just did in a sense is just like, sometimes it's just breathing in and out and just feeling the sensation of the air going in and out of your lungs and in and out of your body. And so when I'm having a hard time, like it's very difficult for me to get centered. And, I think it's hard to sometimes expect, oh, I'm going to do mindfulness for 30 minutes or something like that. And so it's like, what can I do to just allow myself, 2 to 3 minutes, and that it's again all that principles of just trust and allow and know it's going to be okay, and I can take this time for myself. So for me, I like just like quick body scans, of just like feeling my feet on the floor or feeling just sensations in my body, or if I don't have enough time, just let air go in and out and just focus on that sensation. So that's, yeah, something that I like. Yeah. Thank you. Great question.
We had talked about how different disciplines incorporate these principles without naming them as mindfulness principles, like
Mm,
encouraging deep breathing or box breathing or that sort of thing. Um,
yeah.
and I think, you and I had talked about that I've gotten that advice from physical therapists, but I think we encourage it when we're taking a blood pressure in nursing or,
Yeah.
that sort of thing.
Thank you for bringing that up, Barb. Yeah, that's right. Yeah, the box breathing is really good because it regulates your breathing, 4 seconds, breathe in, 4 seconds, hold, 4 seconds, exhale, and then 4 seconds, hold again. For me, I really also like when you're trying to kind of slow down physiological response or like the heart rate and stuff, the longer you exhale, the more that can calm that down. If you're ever feeling a little low energy, it's actually supposed to be a shorter exhale. So, and then that kind of gives you a little bit more like alertness and awareness. But if you're trying to kind of, slow down the physiological heart rate, then it's
So
as long as you can.
I think Tracy must have heard you and me talking the other day, because she mentions, I think that one challenge might be that mindfulness might be seen as something beyond their normal expectations for healthcare. Um, One patient initially called it woo woo therapy, and I needed to reframe it to something he could relate to. Breathing was a good opener, as everybody needs to breathe.
Ah, that's so interesting. Yeah. So I think one way, because I kind of felt the same way, and it's not that, yeah, people certainly feel like, oh, really breathing. And I kind of just bring it back to like evidence-based research and how this is really a thing, and it's been researched so much in so many different ways and in so many different contexts. And so that this is like, a real intervention that does work. And so that they don't have to think about it in that concept. And then for me, because like I practice it myself, I can kind of give that feedback of, I didn't believe it at first either. And so sometimes that helps them feel like, a little bit more connected. So I appreciate that. Thank you, Tracy. That's a really good comment. And that was a good way of explaining it to a patient, that person.
Yeah.
Yeah. Yeah.
Great.
Normalizing it. Yes, normalizing it. That was really good.
Other questions? I think based on a comment made earlier by David, that part of it is people are still soaking in the description that you have about mindfulness and having the slides as an incredible resource for this. So thank you so much.
Oh, yes. And I think the more you just allow it to be, I think the more it just helps. It helps me anyways. The more I just allow it to be whatever it is, the more you try to control, then the more frustrating it can be. And so, yeah, it is a lot of information to digest. So yeah, thank you so much for being here and listening to that.
Okay, so I have another weird question. This is for the attendees, but do you think it's more likely that you bring up or would bring up mindfulness considerations among your colleagues, among your staff, or among your patients? Because, we all have stressful situations at work as well, and we gather for various things, and sometimes the stress or the issues come up in the work setting. Sometimes it comes up with patients. Are you more likely to sort of tackle mindfulness and wellness among your colleagues or among your patients in terms of mindfulness? Because I guess I got, Emily, from your presentation that both are important.
Yeah. Oh, yeah, absolutely. Like I think it's something that we can really definitely practice ourselves, and that, yeah, the more that we do, the more we can explain it or share it. And yeah,
Yeah.
yeah. So I think that is a good thing. I was just putting in the chat, I remembered because you were saying the box breathing. So I can't remember if I said, but the 4-7-8 breathing is actually one that I really like. 4 seconds inhale, 7 seconds hold, and then 8 seconds breathe out.
I've heard that too, and so I've never known, should I do box breathing, which is the 4-4-4, or the other one that you identified with the sort of longer intervals?
Yeah. I think everyone has their own thing that they feel most comfortable with. And so they
Mm-hmm.
try it out, and I give them all these different options, and they just kind of try it out, and they're like, oh, I like this one the best. And so,
Mm-hmm.
yeah, but box breathing is a good one too, to kind of help regulate and put you in a, yeah, cycle.
Well, we're getting close to time, so I would just sort of challenge you all to consider bringing up mindfulness and wellness, both among you and your colleagues, but also thinking about ways to introduce your patients to these considerations and the possibilities and benefits. And I look forward to seeing you all next week. We are going to be having a discussion, really different kind of change of focus on skin lesions. I guess you could argue that that's a stressful thing sometimes for people too.
That's right.
So thank you, Emily, so much for all that you've shared today. It's really given me, I did go through the exercise, I want you to know, even though I resist those things sometimes.
Thank you.
And thanks everyone for being here today, and I will see you next week, same time.
Thank you.